So, hi everyone, welcome to the meeting, weekly meeting. So we're gonna start today, and the orange team will lead this meeting. So when you are ready, Dr. Kholood, please go ahead. Thank you.
Thank you, Dr. Mohamed. Yes, we will start our meeting today. And before anything, how are you, everybody? Wish everybody doing good and well. And the first agenda is diabetes in old adults. I will present it. So, if you let me share the screen.
Go ahead. Thank you.
Thank you so much. So, I will go here. Diabetes mellitus. Okay. Objectives: know and understand consequences of diabetes in older adults, and how to establish a diagnosis of diabetes, managing hypertension, dyslipidemia, and microvascular complications in patients with diabetes, dosage and formulations of anti-diabetic agents. Sorry for some issues here, but okay. We will cover epidemiology of diabetes in older adults, as I said, and consequences of diabetes in adults, also classifications of diabetes and pathophysiology in older adults, diagnosis, managing diabetes and its complications, education and self-management support. Okay. So, epidemiology of diabetes in older adults, it affects 15 to 20% of people, 65 or older, one of the most common chronic disease in that age group. Age-adjusted prevalence higher among Black and Hispanic Americans than white Americans. As we see here in the US, more than 40% of all of people with diabetes are 65 and older. Consequences of diabetes in older adults, 10 years reduction in life expectancy, and 2 times higher mortality rate, 2 times higher risk of atherosclerosis, neuropathies, loss of vision, and renal insufficiency, and 2 times higher rates of MI, stroke, kidney failure. 40% is higher risk of blindness, and 2 to 3 times higher risk of mobility disability, and 1.5 higher risk of disability in the activities of daily living. Okay, older adults with diabetes are at higher risk than those without diabetes for geriatric syndrome, including incontinence, depression, cognitive impairment, urinary incontinence, injurious falls, and chronic pain, and polypharmacy. Okay, classification of diabetes type 1 results from absolute deficiency in insulin secretion that due to autoimmune destruction of pancreatic beta cells, and type 2 usually due to tissue resistant to insulin action and relative insulin deficiency. We have a third category, injuries to the pancreas, endocrinopathies characterized by excess of hormone that antagonize insulin action, drug or chemical-induced diabetes, and infection that destroy beta cells. We have more explanations. If anybody wants to go and revise it, you will find it in the app. So feel free to do that. I just try to do it like concise. Okay, pathophysiology of diabetes in older adults. About 90% of older adults with diabetes have type 2. Diagnosis usually follow years of pre-diabetes, glucose intolerance, or insulin resistance, or metabolic syndrome. Pre-diabetes itself raises the risk of atherosclerosis. Prevalence of both type 2 diabetes and glucose tolerance increase with age. Genetics depends also on lifestyle, influence of aging, certain medications, intercurrent illness, and other physiological stress. Pathophysiology of diabetes in older adults is similar to younger adults, younger and older adults. They are both similar. It has a prolonged hyperglycemia, so it lead to protein glycosylation, accumulation of abnormal proteins, and lead to tissue damage. Hyperglycemia lead to accumulation of metabolic products of the aldose reductase system and impaired cellular energy metabolism, and lead to cell injury and death. So the pathophysiology changes, pathologic changes due to diabetes and its complication, they interact with changes due to aging to further decrease physiologic reserve. Three ways to establish the diagnosis of diabetes. We have clinically symptoms of polyuria, polydipsia, and unexplained weight loss, plus causal plasma glucose equal or more than 200 milligram per deciliter, and cause also at any time of day without regard to time since last meal. So plasma glucose after an 8 hours fast equal or more than 126 milligram per deciliter. Plasma glucose 200 or more milligram per deciliter, measured 2 hours after ingestion of 75 gram glucose in 300 ml water, administered after an overnight fast. Interpreting borderlines results. So here we have impaired fasting glucose, fasting blood glucose 110 to 125, and associated with increased risk of diabetes. Isolated post-challenge hyperglycemia, is it fasting blood glucose are not elevated, or many of these patients would be diagnosed with type 2 diabetes by OGTT criteria, that's oral glucose tolerance testing, appears to increase risk of atherosclerosis, although not as much as type 2 diabetes does. This is the thing called isolated post-challenge hyperglycemia. Clinical evaluation of older adults with diabetes. So you have to evaluate the risk factors for atherosclerotic disease and presence of comorbid diseases. Take through medication history, assess functional status, screen for geriatric syndrome, use of multiple medications, depression, cognitive impairment, urinary incontinence, dangerous falls, and chronic pain. Assess need for diabetes education and self-management support, and whether to involve a caregiver. Goals of diabetes management for controlling hyperglycemia and its symptoms, to evaluate and treat associated risk for atherosclerotic microvascular disease, evaluate and treat diabetes complications, support diabetes self-management and education, and maintain or improve general health status. General principles of diabetes management. Older adults should have the same opportunity as younger adults for intensive diabetes management and reduction of risk associated with diabetes and treatment of comorbid conditions. For some older patients, intensive management of diabetes and its complication is not likely to provide benefit and may even be harmful. Diabetes management goals and clinical targets should be individualized. Okay, preventing and managing cardiovascular risk factors, counsel the patient regarding maintaining appropriate weight, increasing physical activity, discontinuing smoking, limiting fat and carbohydrate intake. Consider drug therapy to treat hypertension, prevent MI as you add aspirin, and treat dyslipidemia. Managing hypertension in older adults with diabetes. Target is blood pressure to be 140/80 for most of patients. And observational studies suggest that target of 130/70 may provide increased benefit. Lower blood pressure gradually to avoid complications. Most antihypertensive drugs classes have comparable effectiveness. ACE inhibitors and angiotensin II receptor blockers have cardiovascular and renal benefits for people with diabetes. Managing dyslipidemia in older adults with diabetes, dyslipidemia should be corrected if reasonable, considering the patient's overall health. Target LDL level less than 100 milligram per deciliter. If LDL equal 130 or more, pharmacological therapy needed in addition to lifestyle modification. Measure ALT with 12 weeks of initiation or dose increase of statin or niacin. Measure liver enzyme annually after initiation or dose increase of fibrate. Okay, in case of preventing managing microvascular complications, dilated eye examination by eye care specialist at a diagnosis of the disease. Repeat annually if exam detects retinopathy, other medical eye disease, or eye symptoms, or if hyperglycemia or blood pressure is poorly controlled. Otherwise, repeat every other year. Foot examination at least annually. Test for microalbuminuria at diagnosis and at least annually thereafter. Pneumococcal vaccination. Oral non-insulin agents, we have like take a general idea for treating diabetes. We have here the second generation sulfonylureas. Its mode of action increase insulin secretion and lower HbA1c by 1 to 2%. We have glimepiride, we have glipizide, generic or glucotrol. We have glipizide, glucotrol XL. We have glyburide or diabeta micronase, and we have micronized glyburide. And here we have the dosage and the classification. Okay, continuing the oral medication, we have alpha glucosidase inhibitors. We have this mode of action like to delay glucose absorption, to lower HbA1c by 0.5 to 1%, acarbose and miglitol. Okay, I can tell about this. This is have a GI adverse effect. Common avoid if creatinine more than 2 grams per deciliter. This is the carbose, and monitor liver enzymes and get on potassium. And miglitol, same as acarbose, but no need to monitor liver enzymes. Okay. As a continuation, DPP-4 enzyme inhibitors. It protects and enhances endogenous incretin hormones and lower hemoglobin A1c by 0.5 to 1%. We have saxagliptin and sitagliptin, and this is a dosage here, 2 milligram. Okay. 2.5 mg if creatinine clearance is less than 50 per minute. And the sitagliptin, 100 mg once daily as monotherapy or in combination with the metformin or thiazolidine. This is my enemy. So we have biguanides here, the metformin. Decreases the hepatic glucose production, lower HbA1c by 1 to 2%. We have the master here, the metformin, glucophage 500 to 2,550 divided, and avoiding patient more than 80 years, unless creatinine clearance is more or equal 60. creatinine is more than 1.5 in men, creatinine is more than 1.4 in women, heart failure, COPD, and elevated liver enzymes, hold before contrast radiologic studies, and may cause weight loss. Is all you have to take care before you are prescribing metformin. Okay, we have metformin, glucophage XR. This is the same like metformin. Meglitinides, rabiglinide, and this the mode of action increase insulin secretion, lower HbA1c by 1.2, and here the dosage of this is 60 to 120 milligram 8 hourly, and this is 0.5 mg 6 to 12 hours. If hemoglobin A1c is less than 8% or previously untreated, 1 to 2 milligram 12 hours if HbA1c is more or equal 8% or previously treated. I think this all have to give before, it's 30 minutes before meals, and here 30 minutes before meals. Adjust dose at weekly intervals. Potential for drug interaction. Caution is hepatic renal insufficiency. Okay. Here, glipizide and metformin. This is like combination, oral non-insulin agents. We can combine it, glipizide and metformin, glyburide and metformin, and bioglitazone and metformin, and ribaglinide and metformin. So here we can add 2.5 from glipizide and 250 from metformin, and here glyburide 1.25, metformin 250, and that's adjusted according to the patient and any underlying problems. Okay, here bioglitazone and metformin 15 to 850, and ribaglinide and metformin 1 to 500. Still we are in combination therapy, rosiglitazone and glimepiride, and rosiglitazone and metformin, and bioglitazone, and glimepiride, and sitagliptin and metformin. So we can see here the dosage and the formulations. Okay, siadolediones, we have bioglitazone, we have rosiglitazone, and here the mode of action insulin resistant reducers. Lower hemoglobin A1c by 0.5 to 1, risk of, it has a risk of heart failure, avoid of NYHA class 3 or 4 cardiac status. And I'm not sure about if cardiac status declines.
Yeah, discontinue.
Okay, thank you. Okay, we are going to injectable this is injectable non-insulin agents for treating diabetes. Okay, we have exenatide. The dosage is 5 to 10 microgram or subcutaneously, and we have here the formulation 1.2 to 2.4 ml. And this is mode of action. This is incretin mimetic, lowers HbA1c by 0.4 to 0.9. Nausea and hypoglycemia common. Less weight gain than insulin. Avoid if creatinine clearance is less than 30. Okay, bramilinide 60 units subcutaneously, And it is a myelin analogs, lower HbA1c by 0.4 to 0.7, cause nausea and hypoglycemia, reduces pre-meal dose of short-acting insulin by 50%. Okay, rapid-acting insulin preparations. We have insulin glulisine, onset 20 minutes, peak 0.5 to 1.5 hours, duration 3 to 4 hours. Insulin Lispro, 15 minutes onset and peak 0.5 to 1.5 hours, duration 3 to 4 hours. Insulin Aspart, 30 minutes onset and peak 1 to 3 hours, duration 3 to 5 hours. Regular insulin, it is 0.5 to 1 hour and peak 2 to 3 hours and duration 8 to 12 hours. Okay, we have MPH insulin, onset 1 to 1.5, peak 4 to 12 hours, duration 24 hours. Insulin Determir, 3 to 4 hours, peak 6 to 8 hours, and duration 6 to 24 hours. Insulin Glarine, Lantus, 1 to 2 hours, onset and peak, have no peak. Or here, duration 24 hours. Isofene, insulin, and regular insulin injectable, Novolene, 70 to 30, peak onset of 30 minutes and peak of 2 to 12 hours, and duration 24 hours. Okay, here we go to education and self-management. Sorry for that. Education and management. Self-management support. If the patient is clinically complex, consider referral to the diabetes educator, disease management program, or specialty physician care. Annual diabetes self-management training is covered under the Medicare Part B. Involve and educate caregiver if the patient is cognitively impaired, significantly disabled, or frail, or has limited proficiency in English. Educate patient and caregiver about hypo and hyperglycemia, precipitating factors, prevention, symptoms, monitoring, treatment, when to notify the physician. Blood glucose self-monitoring when appropriate, diet and physical activity, medications, purpose of drug, and how to take it, and common side effects, and important adverse reactions, and food care. Here we have a summary of both diabetes and impaired glucose tolerance are important to identify and address because of the great heterogeneity in the older population. Treatment goals for older patients with diabetes must be carefully individualized. So the target is debated. Attempt to lower blood pressure as tolerated are important for older hypertensive patients with diabetes. Diabetes self-management is an important part of diabetes care. And annual self-management training is covered benefit under Medicare Part B. Okay, we have 4 cases here. So we will start case 1. An 82-year-old man living in a nursing facility is evaluated because of gradual functional decline. He has lost 4.5 kilogram, 7% of body weight since he entered a nursing facility 6 months ago after hospitalization for acute myocardial infarction. During the hospitalization, type 2 diabetes was diagnosed. In the nursing home, he has remained hyperglycemic, with periodic blood glucose concentrations spiking to 300 milligram per deciliter, and a recent HbA1c level was 7.9 gram per deciliter. Okay, the patient is an here. American Diabetic Association low-fat diet. He takes several medications, including glipizide, pravastatin, hydrochlorothiazides, metoprolol, and lisinopril, and aspirin. This is a lab result. You can take a look here. So, which of the following is the most appropriate next step in management of this patient? Increase glipizide dosage, add metformin, add acarbose, add niacin, liberalize his diet. Yes, I can see no answers in the chat. Yes, definitely is E, liberalize his diet. That's correct. I think it's like caring about the time. So if you need to read the explanation, you can go through there, or I can read it. What do you think, Dr. Nader?
You can skip it. People can look at
Okay.
it or read it later. But yeah.
Okay, thank you. Okay, case 2 here is a 72-year-old man comes to the office for evaluation because he has impaired fasting glucose level. Fasting levels were between 110 and 120 milligram per deciliter on 3 occasions. He has a well-controlled hypertension. His BMI is 29.5. Okay, which of the following is most likely to prevent development of type 2 diabetes in this patient? Reduce caloric intake and increase physical activity 150 minutes per week, increase physical activity and begin metformin, reduce caloric intake. Let's see also Mustafa. We will go with choice A. Yes. Yeah. We have to reduce caloric intake and increase physical activity 150 minutes per week. Okay, here an 81-year-old woman is brought to the office by her daughter, with whom she has been living since the recent death of her husband. She is a former smoker and drinks socially. History includes osteoarthritis of hips and knees, hypertension, incontinence, which has recently worsened and limits her willingness to leave home. She has a stroke several years ago that left her with some right-sided weakness for which she uses a cane. Medications, she's using ibuprofen, glucosamine, hydrochlorothiazide, aspirin, multivitamin since her husband's death, fluoxetine, she's allergic to lisinopril. Weight 90.7 kilogram and height 1.65 and BMI 33.4, blood pressure 126/78 and pulse is 70 and regular. Patient has left carotid bruit, slight weakness and rigidity in her right arm and leg with associated gait abnormality, and bilaterally decreased dorsal diabetes and posterior tibial pulses. Both of feet has slight edema. She scored 29 out of 30 of a mini mental state examination and 11 out of 15 of the geriatric depression scale. Okay, this is a lab result. Cause 165, HbA1c 7.5. HDL. Fasting glucose level 2 days later is 158. Doing analysis is positive for microalbuminuria. Which of the following medication is most likely to decrease higher cardiovascular risk? Bilipizide, metformin, valsartan, simvastatin. B, C, D, 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 E, and D. Let's see, what's the answer? It's simvastatin. Yeah, we have to add simvastatin to decrease cardiovascular risk of this patient. Okay, thank you so much. This is all about diabetes in older adults. If any question, feel free to ask.
Thank you so much, Dr. Kholood, for this great presentation, concise and to the point. Hopefully, people will benefit from this down the road. So you're gonna see a lot of patients with diabetes, and there are a lot of new medications that are in the market that you can also use. Sometimes we have trouble controlling the diabetes. One thing you should ask the patient is their compliance with the medication, how they take the medication. And the other question is, do they watch what they eat? Because these are the two factors that might affect the outcome of the result for the blood sugars. So if you educate the patient about these two, then you can jump to increasing your dose of the medication or adding new medication. So thank you.
Yeah,
Excellent.
thank you so much. Any questions?
Any questions?
Chat here.
I don't see in the chat questions.
I think I cannot see anybody is asking any question here. If no question, we'll go to the second agenda here for today. We have topic of mobile apps for older adults. Dr.Wiam Mohamed is the one presenting the topics. If you are here, just.
Yes, I'm here. Hello. Good afternoon, everyone.
Yeah, that's yeah. Go ahead.
Okay. Let me just share my screen.
Sure.
So now you can see the screen, right?
Yes. Yeah.
Okay.
Yes.
So good afternoon, everyone. This is Wiam Mohamed. I will be presenting the mobile apps for older adults. It's a systematic search and evaluation within the online stores. So I will be starting my introduction. So the demographic change continues worldwide. Globally, the proportion of older adults, those aged 65 years and older, will increase more than 60% until the year 2030. In 2050, it's estimated that 1.6 million people, which is around 16.7%, will be aged 65 years or older. So this global aging poses a variety of challenges to the healthcare system and their sustainability. These challenges can be in terms of increasing costs. It could be a potential medical and social undersupply to older adults due to lack of the healthcare professionals in the future. And it could be a physical and cognitive functional environment changes in social relationship, the socioeconomic status, and the loneliness. So the mobile and internet technologies, such as mobile apps, they offer a possible approaches to increase the empowerment of the older adults. This can be done through a variant categories. It could be through social support activities, preventing the cognitive and physical decline, decreasing the loneliness, and provide assistance in everyday activities. The mobile and internet can also offer many advantages for the older adults to complement the traditional healthcare behavior, as they can be cost effective. They also have a potential to simplify the social and medical care. So smartphones have become an integral part of everyday life, even for older adults. In 2017, 40% of the Americans aged 65 years and older were using smartphones. 2 years later, 73% of Germans aged 60 to 69 years are using a smartphone. So many studies imply that due to the aging of the baby boomer generation, more adults will use the smartphones. The problem with the mobile apps, that the users can have problems identifying mobile apps that will effectively and safely support them in their healthcare. This is because there is a vast number of available mobile apps, there is opaque dynamics in the app stores, and there is a perceived lack of technical knowledge in older adults. So one of the studies that has been made regarding the mobile apps in the stores, so it elaborated a few categories that the mobile apps can be categorized based on. So these are examples of the categories for that. Sorry for that. So the categories, it could be a diagnostic applications, it could be those for the history, for the improvement, it could be informative, interface, measurement, and so on. So in the diagnostic category, there could be a different types. It could be for cognitive impairment, for physical and mental illness. Those for the improvement can be a relaxation, speech to text, text to speech, risk assessment, the magnifying glass, and so on. So this study also elaborated the aims of the studies found on the stores. So the study focused on around 80 applications. It was found that 54 of these applications were used for the improvement of the well-being. 39 of them were used for entertainment, and 37 were used for reduction of stress, and 29 were used for reduction of anxiety, and so on. And obviously, there is an overlapping aims for the applications. Also, the study focused on the frequency of the methods used on the mobile apps. It was found the 26 of these apps were used the monitoring and tracking. 25 used the data collection and measurement, the feedback, the gamification, and so on. Also, the study focused on the privacy and the security of the mobile apps because this is an important part. So it was found that 36% of the applications, they asked for the contact person, and the imprint. 34% has a privacy statement. 27 they use a password, and so on. So, on conclusion, that the potential inherent in mobile apps to support a healthy, active, and safe life for older adults has not yet been sufficiently explored. The currently available mobile apps for older adults are on average moderate overall quality. Deficiencies in these can be found in the information quality, evidence-based approach, data protection, and security measures. But on the other hand, some mobile apps were of high quality, were based on evidence, have a sufficient data protection, and therefore it could provide a suitable support. I also came across a few applications that were really helpful during the pandemic isolation period for the elder adults. These apps, it can be of different categories. So regarding the social networking apps, Skype, for example, it was given a 4.5 rating for the social networking. There was also the medical apps. These are the telemedicine. So these are a few examples. The Teladoc app, it was a 4.8 stars. The K-Health, it's a primary care app. And also a doctor on demand. These were given 4.8, and this is 4.9 stars. And these are reviews from the people who used them. The food and drink apps were also for great help. And I believe that was also for all of us, not only the older adults. So the DoorDash and the Instacart was one of the highest rated apps. And there were also a few apps for the visual and hearing impairment. So this is an app called Be My Eyes. It was given a 4.7 stars. And the Glide video app was 4.5 stars rating. So these were really helpful during the pandemic period. And that would conclude my presentation for today. Thank you everyone for listening. And if anyone has a question, go ahead and ask. Thank you.
Thank you, Dr. Wiam. Thank you so much.
Thank you so much, Dr. Wiam, for also great presentation.
You're welcome.
So if no one has a question, I put a link on the chat. If you can just use that link. And you will have this question here. So basically, my question to all of you, let's focus, for example, on the first topic we were talking about, diabetes. Have you seen someone use, or have you used by yourself mobile app to monitor blood sugar on your phone or on like another device? But yes, no, let's see. So a lot of notes here. So it depends again on how many patients or how many people around you use diabetes. So your answer might not be affecting your ability, but maybe just the exposure itself. So a lot of noise. So let's jump into a different one. How about blood pressure monitoring device? Like you can check the blood pressure and then record and then keep that as a log. Anyone of you use any? If not, can I just share with you? This is a template, an app that I developed using an easy app development website. Is called Live also. So it's basically like a spreadsheet, like Excel. You put the variables that you want to track. In my case, I want to track the blood pressure and pulse. So it's a log in, like you log your blood pressure every time you check it. And this is the findings of the report that you can just, if you want to review when you see your doctor, you can share this information with your doctor, for example. And it has some graphs to indicate that your blood pressure out of control or something like that. So share with you the website there in a minute, but I also want to share with you another device regarding the blood pressure monitoring. So there is a new device in the market, or a couple of them. Basically, the patient will put a small needle on their skin, and then they have this device where it's like the scanner. When you move it around that area, it will record the blood pressure at that time. So you can use it as many times as you want. And that device will basically keep the block for you, and you can make basically the graphs that we just showed you. So this is another way of doing making apps or developing the apps and using them in chronic conditions similar to what we just discussed, like diabetes or hypertension or other conditions that you want to track how the patient are doing, and then you can adjust the medication software. So different ways of using the apps. Thank you.
Thank you, Dr. Nader.
Thank you so much, Dr. Nader. Thank you so much. Anybody has a question or? Okay, if no question. I'm looking at the chat now. Okay.
And I want to share with you one more in this topic. So in research, you don't have to do compare medication versus placebo and big trial so that you can get publication. So for you guys, it's easier way to publish something about, let's say, application used in older adults or in whatever category. You can locate this only in the US or in Europe or in the Gulf area or in Sudan. Then I'm going to share with you this paper. Basically, these authors, what they want to do is they want to look at the mobile apps used for behavior changes or changes in other areas like physical activity, diet, alcohol use, or you can use it in different areas like smoking, for instance, and see if these apps can help make changes in the users. And they did a systematic review. So this is one of the things that you can do. You can just look at the internet, look at the articles and studies done there, and do a systematic review on this topic. It's easier, it can be done, and you can publish it as a poster. You can submit it to any of the geriatric conferences. If you limit yourself to apps that are used for example, by older adults. I assume it will be less number of trials in this area, but at least it will open the door for you to work on some of these goals, like if you want to do a systematic review. You can change the keywords here to different things. So this is just I want to share with you. And you can publish this as a manuscript. This authors did this in 2020, so 2 years ago. One thing you can do, you can replicate the same review system of the literature and see if there is changes during the last 2 years. Or maybe you can put the COVID in this title, so we will say before and after COVID or the pandemic with behavior changes, because most of the time people were locked in, and so they were using, as the previous presenter mentioned, the use of different apps during the pandemic. So we can look at also the mobile app for any changes in behavior or physical or other. So this might be something that you can think about when you want to do a project. Thank you.
Thank you so much, Dr. Nader. I think Dr. Talal or somebody raised his hand first, and I think he has an idea about Okay. Is here. I think App Watch has a great app for elderly, like heart rate and auto monitoring, and also associated for risk of fall.
Yes.
Yeah.
Thanks for sharing, Dr. Yes, the device or the watch has many activities or monitoring programs, as you mentioned. So that's great. Thank you. You want to go ahead? Hello, go ahead.
Hello, everyone. Hi.
Yes.
Hi, go ahead.
Hello, Doctor.
Yes, Apple Watch, as I said, has a great application for the elderly. For example, you can put your emergency call. If any movement or fall, the Apple Watch has a sensor to assess the risk of fall for the elderly, and they can send immediately for 911 or for the emergency call. I think that is so great because, as we know, the elderly here, they live alone and they can fall in home and no one know about that. And there is a great story about that in the Apple side about the elderly and how the Apple Watch saves their life.
Okay. Thank you, Dr. Talal.
Excellent. Thanks.
Thank you.
It's great. Thank you. In addition, or question? I see here Dr. Ihab, he said what social network are senior using? Here, like a percentage of Facebook, 46%, YouTube 38%, and Pinterest 15%, like 11%, and Instagram 8%, Twitter 7%. Okay. Thank you, Dr. Ihab. Ahmed. And I think also Dr. Iman mentioned one drug for using diabetes patient, decrease the risk of cardiovascular complications. Thank you, Dr. Iman. You can go ahead and see what the new updates about this. Thank you so much. If no more questions, we are going to the next agenda. Like it's how to write manuscript for journal to be presented by Dr. Duaa Mohamed. If you are here, Duaa.
Yes, how are you? Good morning, everyone. Good afternoon when you're doing it. So, how are you?
Good, thank you. Go ahead.
So, let me share my screen.
Sure.
It's not sure. Just one. So, did you see my screen? Okay. So today we'll talk about the manuscript writing or journal. My name is Duaa Mohamed. Now my screen. Did you see my screen?
Not yet, Duaa.
Hello?
Yes, Duaa.
Not yet? Oh, wow. I just stopped sharing. Okay. So now you see it, Kholood?
No,
No. Okay.
go down to the share screen and click on it.
Okay. What about now?
Starting, still you don't see it.
Let me know when it's seen. Okay.
Yes, not yet.
Now you can go ahead, Duaa.
Yes, yes, no, no.
Okay. So today we'll talk about scientific manuscript writing. Uh, so from beginning the research journey, the idea will transfer our idea, theory, and questions to draft. This draft is exposed to editing, and then editing, and the final draft, it will be your manuscript. So what is a manuscript? A manuscript is a document submitted for publication, or it's an author's text that has not yet been published. So in the past, it can be like a written by hand, it can be book, it can be like documents, and even it can be a piece of music. But today we'll focus about the scientific manuscript. So the scientific manuscript at general, it's under three parts: either original article, or review, literature review, and there is a lot of literature review as well, and maybe it could be a case report. So if it's reviewed and then submitted for the journal that you are already choose and accepted, then it will become the name, the manuscript, the name will be an article. Okay. So before we begin writing, we have to know that this stage now, everything is ready. You're already done with your data collections, and your data is analyzed, and your result is in your hand, and everything is ready. The tables, figures, and even you put your objective. You have like at least 2 or 3 ideas. You already want to go through it in your writing. So now everything is ready on your hand. The research, everything done. Now we'll start writing. So the order of you write is different than the manuscript itself. So the order when you start writing, so this is usually we'll start with something that is already on our hand, the method, or you choose it, and your result is ready and everything is fine. So we'll start with the method and result to write it the first, and then you'll go for your introduction, or sometimes it's called background. After that, you write your discussions, and the abstract is the final part written in your manuscript or your research paper. This is the final part because it's a summary of your what you did. So this is the order when you write. So let's talk about something called MRAD format or MRAD structures. So this is uh, it's a way that you write your manuscript. It's a structure. It's just stand for some. It's abbreviation. So I for introduction, and in introduction you will write what did you start. Why did you start? What is your theory behind your like research? And then the aim for methods. What did you do? What type of method you used? And the R stand for results. What did you find in your results? And discussion, D for discussion, the what does it all means. You have to mention all. We'll talk about each part separate, but this is a MRAD. You have to be familiar with this type of structure because most of the journal use this structure. This is, by the way, not including the other part of the manuscript, like the title, page, and references, acknowledge, and all this. But this is the main structures. So here, the all part of your manuscript, from beginning to end, will start with the title, and then the authors and affiliations. This is together we can say it is a title page. And then after that, you will write your abstract. So if you remember that when we write, we start with, finally we done with the abstract, but when it came to just organize your manuscript, the abstract, it come first. And then after that it came the introduction or background, then material and method you use. After that your results, discussion, acknowledge, and funding, references, and tables. Sometimes you see here tables came after reference. This is usually depend on the journal instructions. So maybe the reference will be last, maybe table before. So this is something we'll learn it at that this structure. It's even you can finish it or edit it at the journal that you're willing to submit your application, your manuscript. Okay. So let's start with the title. Here we have the title. This title is supposed to be the something grabbing attention or attention grabbing, and there is a few words that can adequately describe the content of the paper. And in some epidemiological study, we can mention the study design. It's like case control or case cohort. And the title page, in general, it include the title and the author and affiliations, corresponding author. And the corresponding author, this is the one communicate with the journal, and the keywords. So what is the keyword? Keywords is, let's say in the title we will talk about something simple, this relationship between or association between smoking and lung cancer. So the smoking and lung cancer, it will be in your keywords. So when there is someone go for Google to write, let's say about the smoking and lung cancer, so by this way your paper or your research will be picked up by the reader. And the list of abbreviation, it also goes on the title page. This is if you just mention like CI for confidence interval, so you have to mention this abbreviation stand for what. So this is the title. And here we have an example of title page mirror publication. Here we have this title. It's association between MPSI polymorphism halotypes and smoking related cancer sites. And this here we found the authors and their affiliations. Okay, this the order of the title page. And here we'll find correspondence or corresponding authors. And the keywords here, if you can see the polymorphism halotype from the title, and smoking related cancer. And then we have the abbreviation list, as I mentioned, like a confidence interval, like odds ratio. If you just want to write OR, so you have to mention OR stand for the odds ratio, and so on. So now we're done with the title. We'll go and the author affiliation. So we'll go here for the abstract. The abstract, this is a summary of your manuscript or like a mini manuscript. So you have to be careful when you write your abstract, because this is the most readable section of your manuscript or your article, because this is usually allow readers to quickly scan the large scientific literature and decide which article they want to read in depth. So they can only read the abstract and that's it. So the abstract should be little less technical than the article itself, and it's around 200 to 300 words. Depend, even this is as I said in the beginning, is depend on the journal. So an abstract should the what here. So the abstract, it can be structured. I mean the headline, like you write your objective, then the design, and then you write like a introduction, result, conclusion. So this is a structure. You just write it under headline. But the unstructured, it's just like a paragraph, just like organized or together, but no headline. So this is regarding abstract, and then after that we'll go here for introductions. So the introduction or background, the introduction usually it's answer the question, why did you start? The introduction summarizes the relevant literature, so the reader will understand why you are interested in the question you ask. And the introduction should always provide background, rationale, and objective, review pertinent literature, and briefly state the method of investigations. So in your introduction, usually go from broader background to narrower background to focus on your exact topic. Okay, and it's also like you can divide it like 4 paragraph. First paragraph, it can start by the clinical list story or the anatomical story of the topic that you are interested in, and then you'll go for your the objective or the questions. Okay, so this will be the introduction part. After that, we'll go for material and methods. So the material and method usually will there will be study design. It's is it cross-sectional study? Is it case control, cohort study, and the setting locations. Maybe it's just something done in, let's say in USA, in Europe, in Africa. So it depends on the location. You have to mention it, the relevant dates, period of recruitment, and your exposure and outcome, follow up, and data collections. And the participant eligibility criteria, method, how you select your participant, the method of selection. For case control study, case ascertainment, control selection, rationale for case and control choice. For cohort, the method and follow-up, and yeah, the participant rate. So you have to write everything in your methods part. The number of participants, let's say, everything. You have to mention it in the part of the methods and material you use it. Let's say we use a questionnaire, you have to mention everything. So there is also in the methods part the variable, the variable defines outcome, exposure, and potential confounder and effect modifiers, all this mentioned on your methods. And data source, measurement data, collections, laboratory methods. You have to provide details regarding source of data and method of assessment, what type of tools you use to analyze or assess your methods, the method for assessment. And then if there is any bias, describe any effort to address potential source of bias. And you have also to mention the study size. As I said, the number of participants, let's say, in the exposure and versus outcome. So this is this example for the material and method section. Here we can see. Here he mentioned the cancer cases number 611. Okay, this is a lung cancer cases, and here they mention upper digestive tract cancer cases. So this is a study size. And here, this is the recruitment rate. So let's see, like there is 39% for eligible lung cancer case and 46 for eligible upper digestive tract cancer. And this is IRB info. This is a international review board for research, I think. So you can mention it also in your method materials part. So then you will talk also about the statistical method in this part to explain your variable, how variable were handled in the analysis, and also describe all the statistical methods, how one control for confounding and method for stratified analysis or interaction and sensitivity analysis. And study specific, let's take case cross-sectional study, so analytical method to account for sampling strategy, case control study, how cases and control were matched if applicable, and for cohort study, so how loss to follow up was addressed. So this is, you mention it in your statistical methods part. So here also the example for statistical analysis, here we find some adjustment variable. It's adjusted, mentioned here for like age. Okay, so, and here is a statistical model using unconditional logistic regression. So this is the part, maybe it's a tough one, this part of manuscript. because you have to mention it in details and numbers. So maybe this is a tough part. Then after that, we write your results. So the result in paragraph format, just you write summary of your main finding, presented tables and figures. So the result, it can be just also text like a paragraph, or it can also put some tables and figures. Yeah, either text or the three, like text, tables, and figures. And the result not presented in tables or figures can also be mentioned in this section. As I said, if no tables or no figures, you can just a text, you can mention it. If this is the first time presenting information regarding the study, one may want to present numbers or of individuals at each stage of the study. And this section should include the characteristic of a study participant. This usually, it's if you want to add it as table, it will be table 1, the characteristic of a study participant, the age, the ethnicity, the, let's say, pre-menopausal state, post-menopausal, some characteristic of the participant, and the number of missing, also main result. Main result go to table 2, and any additional analysis, any stratified analysis, any confounder, you can put it in the additional tables. So here, for example, it's table 1. It mentioned the characteristic of participant. Ethnicity, it's African American. Then Japanese, we have a lot of characteristic. And then here we have table 2 for the main results, and the other tables for the additional, like any stratified analysis, like any confounder. Yeah, this is all goes to the result in form of tables and figure. The tables and figures, this is usually should be after the discussion or reference section. So this depends on the journal. It can be after discussion, it can be after reference. So table and figure should stand alone, and a maximum about 6 tables. Sometimes depend also on the journal. Maybe she just requires 3 or 4. And then use a consistent footnoting style. This is also specific by journal, and define abbreviation. So now we're done with the title, authors, and affiliation, abstract, introductions, material method, result. Now it's your discussion. So the discussion, this is the time or the moment you shine. You have to shine and show your knowledge of better literature, summarize key result in reference to study objective. You answer your questions and interpretate what you found with the one that we already we have it in the previous knowledge, and you mention your significance of the paper. So this is a moment that you interpretate everything nicely. Then in the discussion part, we mention also limitation of the study and study finding, if any potential bias, if any tool not used for any reason, if any limitation. And you have to be cautious when you mention your limitation to not affect your paper strength. And whenever discussing your limitation, try to put a positive spin on what you have to say, okay? Then the study, what is the strength in your study? If you use a specific type of tool or anything, so mention what is strong or strength in your study. And the conclusion part of a study, if there is any future direction, if any recommendation you want to mention it, yeah, you can just mention it in the conclusion part. So now we'll go for the acknowledgement funding. And here you can list funding source for your study, let's say, and authors, and thanks the participant of the study for their time, commitment, and participation. And the reference usually use product like ProCite or Reference Manager or EndNote for citation. Yeah, the reference part, it's the most part that depend on the journal specific instructions. So you can use some kind of tools or software like EndNote. So this is very smart tool. You can choose the journal that you want to publish your article, and then this software it will arrange your reference according to the journal you just choose it. As I said, the reference style depend on the journal, and the order of the references can be presented in alphabetical order or by order of presentation. And the formatting for a specific journal can be done using one of these programs that I mentioned, ProSite, Reference Manager, EndNote. And many programs have the journal style preset. So, however, always you have to make sure from these softwares or programs. So maybe they just make sure before always finish or submit your, because maybe this software, they just put format that is not under the journal that you requested. So always check to make sure the formatting is done correctly, and sometimes the journal info may have been imported incorrectly, or in the journal format style may be different than the one in the program. So you have to be sure. Then general rules I have just to remember you always is spell check to avoid error, and use correct and standard nomenclature, and use the, if you use abbreviation, the first time you mention any abbreviation you have to write, for example, if you just write UADT, it stands for the upper air digestive tract, and you have to be consistent, and you can write the number of page also in your manuscript. Final advice, so for you, rewrite. If you just finish your writing, don't say it's ready to manuscript. Rewrite, review it and rewrite, and then read and review and write. So this is very important. And proofread also, and check all numbers and accuracy and consistency. So after that, my manuscript is reviewed and edited and everything is ready. What is next? The next is deciding to publish and submit your paper. Okay, if you decide to submit it, so what to publish? Is it you want to just publish your abstract, or a whole or full report? And choosing your form, which type of journal is best for you and is best for your type of this type of paper, what audience are you targeting, and then research the journal, publication guideline, article style. As I mentioned, is very important. Any journal they have it's a website, there is a author's instructions, you will check it and you will follow your instruction. After submission, the publication procedure take like 6 to 12 months. The author submit. After that, editor is assigned to manuscript. Then editor assign reviewers, associate editors to inspect. Reviewers decide on whether to review paper or no. And several reviewers inspect and edit also. Editor decide on accuracy of the revision and whether to accept paper. If accepted, editor send paper back to the authors with revision that they make it, and then author revise paper and send it back. After that, possibility of second review process can be possible. And after that, if it's all done and accepted, then your paper will go to publication. So here I have some useful resources. You can just use it, or I can share this PowerPoint with you. There is some links, you can use it. And here, this is a very good article about the how to write scientific manuscript for publication. This is just a foundation what I just mentioned. But if you guys want to read in depth about the manuscript writing, what type of scientific manuscript, the literature review types, and all this in depth, so you can just go through this publication. It's very nice, introductions and everything. And I found here some types of website, or just like list. This is called a Strobi. This is something like it stands for strengthening the reporting of observational study in epidemiology. So this is targeting only observational study like case control, cohort, So because this study, they usually detect the rare, let's say, side effect, or so they have some report or checklist. Okay, if you just download it from here, you will find some. You can just look with me for it. So yeah, you can just go with this checklist. You will find it here on this website. When you willing to do any observational study, just put in your mind. Remember, this is Strobe. Okay, and here it's a consort 2010. This is especially for the randomized trial. It's also like a checklist. Um, so you can go and read about it, and you see what is the checklist look like. I just print out these two checklists. I think maybe I will need it in the future. So I don't know how can I use it, but this is what I just like it in this article. Okay, and let's go back for our PowerPoint. And here, this is the topic 2 presented by Wiam Mohamed, mobile app for older adult. You can just also read it. It's an example of article. And this is a YouTube channel for manuscript writing. It's a good lady. I just take some notes from her. And this is a Strobe website. So guys, if you have any question, let me know. That's all I have.
Thank you very much, Duaa. Very great presentation. Thank you so much. Anybody
Thank you
have?
again. Thank you, Dr. Duaa, for great, concise, and very informative presentation. Thanks for sharing.
You're welcome.
Good job, all the presenters. Thank you so much for excellent job.
Thank
Any
you.
questions for Duaa or for other presenters? It's very important topic, and sometimes if you cannot understand the whole concept, what was discussed today, I think it will make sense when you start writing. So it's just by practicing. Some of all this concept will make sense when you write, you submit, you get reviews or rejection, and then you rewrite and then submit it either to the same journal or different one, and then maybe you can succeed in the second time. Thank you.
Okay, if no question, we can go to the next agenda. How to write personal statement. Presentation by Dr. Nafisa Mustafa. Nafisa, if you are here.
Okay, do you hear me, guys? Hi.
Yes, Nafisa, are you? Yes, go ahead.
Thank you. My name is Dr. Nafisa Mustafa. I'll be presenting how to write personal statement. I hope that it can help you during the match season. And I hope that everyone already started writing their personal statement. So let me start sharing the screen and just let me know if I share it. You guys see my screen?
Yes.
Yes, Nafisa, you can go ahead.
Is my voice clear to you or no?
Yes, it's clear.
Good. Okay, so I'll start writing the personal statement. So first of all, that there is some just menu how the topic to cover today. It's what is the personal statement itself? What's the content that it should be included in the personal statement? The writing phase that we have to go through in order to finish writing the personal statement. Checklist, which is checklist, which is a feature or goals that you have to achieve by writing your personal statement, and what to avoid or common mistake. And at the end, there's reference that where I get my presentation, as well as some places that you can go to review your personal statement. So personal statement, it's a written description of one's achievements, interests, and experience. It's an integral part of successful application, which gives the residency program the chance to get a sense of who you are and your commitment to your chosen specialty. So use it as an opportunity to share a story that you only can tell. Unless you know someone in the program, if you know the program director, the resident, no one will know exactly who you are, what's your quality. So by just the personal statement that offer the opportunity to show like your interest in choosing a specialty when applying to residency, and also illustrate how good you are and how good fit for this program. And it's better to offer like more detail about your why you're choosing this specialty, and how your accomplishment, your experience, and make sure that reinforce your interest in this specialty. So the stronger your personal statement will be, the better the match success will be. So remember, it could be a determining factor between you and another accomplished applicant to use it. So use it to stand out in the crowd. By mean that it just you can be, for example, you've been interviewed by program, and there is there is the program, they receive like thousands of applicants. Some of them, they can share the same experience as you, same qualification coming to the scores, year of graduation. So by showing your personality in your personal statement, that could be a big difference, and it can change your position in the ranking list as well. So the content, first, the layout of the personal statement has to be, or better to be, 1 page, and the words count between 500 to 750. And the content contain like introduction, body, and conclusion. So introduction, as many experts, they mention that it's better to write it when you finish your entire personal statement. So leave it at the end because it's an eye capture for them. So after you finish your whole personal statement, try to find a nice opener that can let the reader engage in your personal statement. Okay, so the introduction itself, like it can be related to your interest in the specialty in which you're applying, or hobby, personal experience, or even about your background. So regardless of the topic you're choosing, you want to tell a story that start with something will interest your reader, and as I said, engage them to your personal statement. So coming to the body, is that composed of 2 paragraphs, 2 to 3, or sometimes it can be 4, and focus mainly on your interest, quality, and experience. So that's a very important part of the personal statement. So you need to show them that who you are and your commitment to your chosen specialty. And also, it's very important that when you mention or write significant experience that you have related to your specialty, like why you choose this specialty, your future goals, information about, for example, your rotations, elective, internship, volunteer experience, and research experience, or any significant outside interest or hobby, that also you can mention it. And the last one, that's the conclusion, which is mainly it should be covered in your future goals and what you will add to the program. So the conclusion, it should be about the residency program itself. What do you desire, or what you want to learn in your residency? What you will bring or add to the residency program, that's definitely from your experience or background. And if you have an idea of your future career goals, or a specialty that you want to explore more during residency, or even a fellowship that you desire to join, so write about that as well in the conclusion part. So coming to the writing phase, so we go through 3 phases, and it's better to, or ideally that to start writing your personal statement at least 2 months prior to submitting your application. So the phase 1, that start by brainstorming. So that's important phase. That's why you need to take it easy. You need to take your time in that, because you cannot just sit down and have all the ideas at once and you write your personal statement. For example, myself, I create a note in my phone, or Also, I did a group between me and my sister. So whenever, for example, I have an idea while I'm driving, while I'm talking to someone, watching TV, I just record that. So at the end of the day, I can just gather some information from the idea that I recorded. So that's when coming to brainstorming, or just write it in a piece of paper. So, and also that you should prepare by brainstorming, you should prepare several questions and try to answer those questions. So that's another way or better way to direct you to write your personal statement. For example, I will give you some example of the question that you can prepare, why internal medicine? So for example, that if you want to choose the internal medicine as a specialty. So why internal medicine? What experience in your CV that can lead to choose this specialty? So what's important part of you is not, which is not on your CV. That's something also very important to put it on your personal statement. Another question can be like, who is your role models and why that's a person or it's your role models? What is the most meaningful experience in your CV that you want to shed a light at in your personal statement, and why it's very important to you? So it's very important to not mention all the CV or to rewrite all your entire CV in your personal statement. Try to choose one or two from your experience and just shed the light on them in your personal statement, and also emphasize like how or why this in particular experience is very important to you. Also, you should better talk about your accomplishment. That's especially if there's any of your accomplishments that you're most proud of. What kind of position that you want to be in the future, and what's your dream, for example, specialty that you wish to join. So that's phase one. So by that, you creating multiple drafts. So the second phase, after you brainstorming, you creating multiple drafting, and then you summarize it and cut it down and make ideal one draft. The third phase, that's going to be revision. So in revision, that's very important, because revision that you have to have, like, for example, several people that you know, for example, a resident or people that they already wrote their personal statement, they will be helping you, or there is some professional that you can go to them, because in revision, you're not just reviewing your idea, it's also the grammar. You want to make sure that the sentence are well structured, no grammar or spelling mistake, because that's critical. And it should be, reviewed by a professional. So that's when it's come to phase 3. So checklist, or that's checklist that you have to be included, not have to be all of them. You can choose some of them. And this checklist that I got them from MedEdit's website, you can see a lot of them over there. So also very important that you can write different personal statement to specialty you are applying. So for example, you want to apply to internal medicine, to family medicine, make sure that to write totally different personal statement. And also, if there is any particular program that you are interested in, it's better to write a personalized personal statement for that specific program. So in the checklist, the personal statement should be about you. It's not should be about your country that you're coming from. It's not about how your college that you graduated, that's one of the best college in the country. It should be about you yourself. So that's the first thing. Second, that clearly outline your interest in the specialty. So as I mentioned before, the question that's supposed to answer, it just like what is your interest in this specialty? What led you to choose this specialty? And so that's the first one. The second one, show your qualities, characteristic, and experience. That's another thing that's very important. Your CV already told everything about you, your qualities, your scores, your year of graduation, the college that you graduated from. But it's better to choose or write that or rewrite it in your personal statement. Make sure that's, your story, it's reflect how good you are. Like, for example, you want to write a hard worker. You're not going to mention or list that you are a hard worker or you are a good team leader. So just tell your story or let your story reflect who you are and how hard worker you are by adding some evidence and some personal experience. That's can bring, like your personal statement to life. Ensure your personal statement flows well. That's also very important, that by adding, like in the sentence, that's transitional sentence or word, that's very important to flow well from going from one story to the other. Be professional. Make sure or be careful on the word that you're choosing. Remember that you're not writing to your friend, you're writing to a residency program. So you have to be professional in your personal statement. The reader here is different. For example, if you write in a journal or in an article in a website, so it's according to your reader, your word has to be specially chosen. So personal challenges. So personal statement also can give you opportunity to talk about a personal challenge, which is that something cannot be reflected by your CV. So your CV tells them your experience, medical experience, but the personal challenge, how, for example, you moved to US, or how it was hard for you to start preparing for your exam, or if there is anything that happened in between, especially for people with old grad, that's an opportunity for you to just tell about those personal challenges. Who you are outside the hospital. Remember that the residency program, when they choosing you to join the residency, they actually adopting you. So by the end that you're gonna have their names, like when you go and you finish with your career, you're gonna have at the end your name. You did your residency at this particular residency program. So they are careful when they choose their resident. And also for the upcoming 3 years, you will be, or 4 years, you will be working with them closely. They want to make sure that you are a person who is like easy to work with, who can respect other resident, respect your supervisor. And also, for example, that's for example, let's say someone who is old grad and already finished his specialty overseas, it's also they need to know who's that person, because you can have like more experience than your supervisor. So they want to know that you are a person that easy to teach as well. And outside the hospital, that you can just talk about your hobbies. So that's even you can have like a life outside the hospital. You're not going to be just working as resident without sharing your hobbies with other residents and your attendant as well. What you are looking for in the residency program. That's also something that's very important. They like the residency program, they like to know what is your, like your goals in the residency, what you want to focus. For example, if you are choosing any others, you want to focus, for example, in one specific specialty or something that you want to get during your residency, also outline that clearly in your personal statement as well. Mention what you will add to the residency program. And that's something definitely from your background and your experience. So by hiring you, what you're gonna add to their program. Your future goals, as I mentioned before, what kind of physician or what type of physician that you wanna be in the future, what fellowship that you wanna join, what specialty that you want to focus. And that's very important for them, because from there they can sign you some mentors since the first year to guide you through that and help you to achieve your goals. Okay, so I'll give you some example of personal statement, and this one is a personal statement to internal medicine IMG program. So this one I chose it from the internet. I like it because it's very simple, and I highlight just some of the checklists that we did, we mentioned together. So for example, here they said that they say cancer is a great equalizer. It affects the rich and poor, reaching across the culture and classes. However, throughout my medical study, I have seen that the treatment for cancer are not equal across nations. So from the first paragraph, you can see that how he started or she started her personal statement. She wanted to capture our eyes on the cancer itself and how she related that when we go further to her experience. So the preferred treatment for cancer is widely varied across countries, with some drugs approved for use in and some not others. However, in the area where I have worked as an oncologist for 3 years, I have noticed that some treatments are simply not available to my patients. It's for this reason what I hope to apply for the International Medical Graduate Program in Internal Medicine so that I can have the opportunity to learn the newest and most effective treatment method for a variety of cancer types. So as you see from this paragraph, it's very simple. It's directed to his goal or her goals, and also they show that some experience. So from the beginning, start with cancer, and now she told us that she worked as an oncologist for 3 years. And also in the last paragraph, she outlined clearly her goals. So during my time in the clinic, I have noticed the need for more advanced treatment for types of cancer cases admitted to the clinic. During my first year as a resident, we received a case where a patient presented with metastatic kidney cancer. Through my research, I have read that she would be an excellent candidate for chemotherapy and radiation, but the radiation facilities were so overbooked that she could not get on the list in time. Additionally, the chemotherapy options available were of previous generation and come to the devastating side effects. This experience showed me that in order to improve cancer treatment in my country, we would need to seek outside experience. So also clearly outline that they have research experience as well, and also why she want to join this program. My goal is to become a physician that can provide new perspective in cancer care in my country and arise awareness regarding the new treatment modalities available. This IMG program in internal medicine will allow me to work alongside other interests that will train me in the newest technique for treatment of cancer, as well as give me the experience that I will need to identify cases that qualify for treatment. I believe that skills that I will gain from this program will enable me to save many lives in the future and to continue to contribute to the field of medical research. So also she was clearly that she want to continue her education and join for the field of medical research. So you can see the checklist that we mentioned before. It's clearly mentioned here, and it's in a simple way for this personal statement. I like this personal statement. It's very short, it's simple, and it's clear and outline everything. Okay, so let's come to what avoid. That's also, it's very important to what avoid. Writing your entire CV, that's which is a lot of applicants do, and also I'm one of them. I just make my personal statement. It's a mini CV for me. So that's a big mistake, and absolutely not do that. So avoid any grammar mistake. That's also grammar mistake and spelling mistake. It's a critical part for a personal statement. Do not write why you want to be a doctor. That's especially if you are an old grad. We already know that you're a doctor, especially if you finish your residency overseas. We already know that question. We know that you are a doctor. We need to know why you are interested in this specialty more than why you are a doctor. Do not use the personal statement to make an excuse for any failure. That's also a lot of people, a lot of experts, they mention that personal statement is an opportunity for you to talk about, for example, low scores, repeated course in your college, any attempt in your steps. But do not write it in a way that as an excuse for failure. So in case of failure, concentrate on on all things that help you to overcome this hardship. Let them know how who you are and how you overcome it, and how you become a better version of yourself. So that's instead of just making an excuse because that happened to me, because my father was sick, because this and this. It's very important to just let them know that how you overcome those challenges. Do not use analogy that can be easily misinterpreted. Like, for example, if someone that was applying to pathology, let's say that, for example, you mentioned that they choose this specialty because I'm not good when working with other, or I'm shy. So that's also they kind of questioning you, like, okay, so why we should hire someone like that? Maybe that someone is hard to work with. So do not use any of those kind of analogy, which can be easily misinterpreted. Do not hire someone to write your entire personal statement. That's very important. A lot of people, they can need, for example, you can do your manuscript and let someone to help you with, but hire someone to write your personal statement. Just make sure that that someone is not you. He doesn't have the same experience. He doesn't have the same interest. So definitely will be clearly, like when the program director or associate reading your personal statement, that will be obvious while reading that that's not you, and that being written by someone else. And of course, you should avoid plagiarism. That's something that's very critical. A lot of people, they go to the internet website, they just copy paste the personal statement that they found online, and believe it or not, they receive a lot of applicants with the same issue, and they already kind of memorize all of the personal statement that's online. So try to make your own, try to make it brief, as simple as possible. Try to make give a life to your personal statement by telling your experience, your personal touch on it. And that's would be helpful a lot. And as I mentioned before, it could be determining factor between you and another qualified applicant. So that's some reference. That's where I got my presentation from. And also you can go to their website, for example, make edits, that you can see the checklist in particular, it's mentioned there. And also those reference, for example, if you needed someone to review your personal statement. And one of my colleagues, she mentioned that the Department of Labor, that they have a specialized part that for free, that they can go over your personal statement, and as well as helping you to review it. So that's something that we can look for as well. That's for people that they live in US. Okay, thank you. And if there's any question, just please let me know.
Thank you so much, Dr. Nafisa. Very nice presentation.
I have something to add. Can you hear me, guys?
Yes, who's talking?
Okay, Ragda. Hi,
Yeah.
this is Ragda. So anyways, I watched this live by Dr. Cornet Fisher, and he was speaking about the personal statement. He says when they read the personal statement, what they pay attention for is actually how you write personal statement and the grammatical mistake, if there is any. They don't care about the topic itself. Honestly, that was heartbreaking because I was putting all my heart in finding a topic that's really good, but that's what he says. He say they only care about how it's written. And he mentioned another thing that he mentioned. He said usually the international medical graduate, they ace the personal statement better than the American, because the American, they think that they are native English speakers, so they don't even got a profound it, or that's that good luck, everyone.
You're right. I kind of agree with you, and there's lots of experts also mentioned the same thing, but you may never know. There's like program directors, they're different, and you will be surprised that one of the program director actually chooses you just because of something you write in your personal statement. So there's a lot of program directors, they don't care about the topics, but some of them, they like the experience. I have a friend that was mentioning the entire personal statement about how he liked to cook pizza, and the program director actually love or enjoy doing that. So that's something that the entire interview about this in particular. So you may never know.
All right, thank you. I just, you put a lot of heart, a lot of time, a lot of everything in personal statement, and someone speaking who didn't match twice. That's why I'm so disappointed. Sorry. Good luck, everyone. Thank you.
Thank you for your addition. Thank you so much.
Thank you.
Go ahead, Kholood.
Yeah. Okay. Go ahead, Dr. Nader. If any addition or any.
Thank you. Thanks. I'd like just to thank the presenter, and really it's excellent topic and excellent presentation, Dr. Nafisa. Thank you. And Dr. Baba, thanks for sharing your point of view. So again, when you apply, there are different factors. One of them is the personal statement, but other factors that the program committee will look at. So it's better to focus on each part of the application, your personal statement, your CV, your hobbies, your let's say languages, something you can improve on besides the clinical skills or the research part as well. So we can work on that as we go along. I shared with you guys a link to some of the examples of personal statement and grant application from previous fellows from this program who kindly shared their personal statement so that we can look at and also see how things can be done if you need some help in this area. Along with some of their application, like grant application to different programs. So you can look at this and see if it's helpful or not. I hope it will be helpful to some. Thank you so much.
Thank you so much, Dr. Nader. We are done about our agenda for today. And now we can go for project update, if any news.
So please feel free to interrupt me if you have any news or ideas. So I would like to share with you some of the things that. So this is the app where we set some of the personal statement and the application for you guys so that you can look at. One of my colleagues, her name is Erin Sarvisky, and she is an internist and geriatrician. We went to the same intermedicine program and then same fellowship. And when she graduated, she had different areas of interest. You can look at her CV here. And one of the interesting part of her area of interest is working with the Department of Packaging here at Michigan State University. Anyways, what I want to share with you is as soon as she finished her fellowship, she was writing this piece, the Caregiver Chronicle. And I can share with you the actual article. Basically, she wrote one of her days with her kids, young ones, and then compared that with her patients, older patients, let's say dementia or incontinence or something. And it was published in a very good journal, the American Journal Geriatric Society. So not necessary for you guys to focus on doing like research projects to write a poster and submit to conferences or write a manuscript and work hard and submit to a journal and maybe submit if they are not. You can also write about your life, your daily life, day-to-day, your personal or what happens around you in a form that can be used and explained explain things in medicine to other people who can read your own stories. So it can kind of give you the idea of your personal statement will help you in your application process to get into residency, but also it will help you if you want to write some stories or perspectives that you can also publish in some of these journals. This is one of the two journals. So I just want to share this with you so you can just open your mind. Thank you.
Thank you, Dr. Nader. Thank you so much. It's very helpful. Then no question. I cannot see anything in the chat.
Nafisa, go ahead.
Yes,
Mustafa,
good evening, everyone. I hope everyone is having a good day. Thank you for the presentations. I have just updates regarding the COVID-19 and pancreatic comparison in the geriatric and pediatric populations. Right now, we started writing the abstract and we're almost done. Hopefully by this week we'll be done. And then we'll be providing the abstract to Dr. Nader, and hopefully then we can meet and discuss our possibility of publishing or presenting. Regarding our flow chart, we wanted to use the populations, like the sum of the populations. However, we had some researchers that did not include the population size. So we have Dr. Arish that had an example where the flow chart would include the research total number of researchers. So we thought maybe we can use that instead of the population number. And then we also had an idea where we could add the flowchart and tables in a manuscript rather than an abstract. So we will be done with the abstract and then we will start writing a manuscript. We have a question, which is, can we post an abstract and present it also, or does it have to be just presented and or just like posted only? And thank you.
Sorry, I didn't get the question. Maybe if you can clarify. The poster.
Our question is, is the abstract, should we just present it, or can we present it and also publish it somewhere?
So basically what happens is your form of the abstract, you can submit that to, let's say, the American Genetic Society meeting or other conferences where you just submit the abstract, and if they accept that abstract, you can translate into a form of poster. So you can actually put the poster there or maybe online, and then you explain things or you present your poster. Some of these societies or conferences, they have their own journal. Let's say the American Geriatric Society, they have the journal that I showed you just a few minutes ago. So some of them, whatever abstract accepted or poster that's accepted for their annual conference, for example, will be automatically published in their journal. Some they don't, so it will be just considered as a poster, and when you are done with the conference, that's it. But you can put it in your CV, but no one will find it in published area. So it depends on where you want to submit your poster and how they are dealing with that.
Okay, thank you. Yes.
Good question. Any other questions? And thanks for that. If not, we can jump to prepare for next meeting. So I can share the screen. I think the yellow team will be moderating or going over the next topics next week. So maybe we can handle some of the hypertension and how to write or work on systematic review. And then maybe we can divide this PRISMA statement into two parts because it's very important to understand and know how things are done So some of them will have explanation and maybe example or elaboration. So maybe some of members of the yellow team can work on this. I didn't put any names. I'm not sure your availability. So maybe Dr. Wiam or the group in the yellow team can work on this so that we can work on some of the projects using system review as an approach. After that, we will talk about case presentation and how we can use that for also, for example, poster or manuscript. Any suggestions, any questions, any additions? I know we have some of the dentists in the group, so down the road also we will talk about their area. So I hope they will come up with some topics and then we can schedule this in the next coming meetings properly. So it's 4 o'clock. Yeah, go ahead. Mohamed, go ahead.
Yes. Hi, everybody. Yes, we talked last week about the topic, and as you said, we're gonna talk about the Sjogren syndrome, about things that's related to elderly patient or geriatric patient, and we need to schedule a phone conference with all of us to discuss the title or the question or the research questions. I will keep you posted as soon as we get that ready.
Sounds good. Thank you so much.
Thank you. Mhm.
Thanks. Anyone else? Any other questions, comments, any suggestions? Again, if you do, let's say you have some questions or something unclear or you have suggestions, please shoot me an email, text me or call me. We'll be happy to discuss and modify our approach. Again, the goal is to help you guys and improve our skills or knowledge, and hopefully we also carry on this program for the future. Thank you, everyone. Thank you, Dr. Kholood, for carrying on in this moderating this Zoom meeting. Thanks, everyone who attended.
Thank you, Dr. Nader.
Thank you. Thanks for presenting as well, and have a wonderful day or night or morning. See you next week.
Thank you.
Thank you.
Thank you, Dr. Nader. Thank you, everyone.
Thank you, Dr. Nader.
Thank you.
Thank you, everyone.
Thank you, Dr. Nader.
Thank you. Have a wonderful one.
Thank you.
Thanks.
Thank you, Dr. Nader, and have a great day, guys.
Thank you so much.
Bye-bye.
Bye.
Thank you.
Thanks.